Medical professionals are warning South Carolinians that if things don't change when it comes to vaccination, masking, and social distancing, we could be experiencing the highest surge in COVID-19 cases to date. As community members continue to get sick, many want to share their stories to help others take precaution. News 19's Emily Carell has the story.
I can honestly say with myself being vaccinated, I do believe that's what saved me from having the symptoms of the fever, the throwing up, the headaches. I have not had any of those symptoms.
Crystal Guest received the Johnson & Johnson vaccine back in March and is now witnessing firsthand the effects of being sick with COVID-19 at the same time with her 16-year-old son, who was unvaccinated and is also experiencing the illness.
No, I've been fortunate now because my son, today is the first day he's not had fever.
Crystal's son Caden was scheduled to get his vaccine Wednesday, but woke up feeling unwell. The whole family went to get tested for COVID-19, and both Caden and Crystal tested positive.
He's had 102, 103 fever since Wednesday, and he's had nausea. He's been throwing up. He's had a headache so bad he couldn't stand up. I mean, he's had the major symptoms. But the only thing I've had is just sneezing, runny nose, and a sore throat.
University of South Carolina student Ashley Schmidt had all the severe symptoms Caden had, but she actually received the vaccine earlier this year.
I don't want other people to get as sick as I did because I don't wish that on anybody. That was the sickest I've ever been.
Ashley's 3 roommates also tested positive with weird symptoms as well, like chest pains, dizziness, head congestion, and more.
I had Moderna, and I had the worst symptoms. My one roommate had Pfizer, and she still had really bad symptoms, but not as bad as me. She still was really down bad. And then my other roommate, who was unvaxxed, only had the sniffles, and the only reason why she got tested was because we all tested positive.
And while Ashley and her friends' situations stand out, medical professionals are still encouraging not only vaccination, but physical distancing and masking as well, because hospitals are filling up.
It was so bad. The hospital was packed with people. Oh, it was packed.
Dr. Wendell James at Prisma Health says they need the public to work with them.
We beg you, please work with us. We have no other interest but yours. As we're dealing with the younger population, we have young fathers and mothers coming in here going on vents, and some of them die. That was not with the previous 2 surges. There's stronger people that are coming and getting this virus than we previously saw.
I hope people take it more seriously, especially some of my friends. After seeing how sick I got, I feel like some people are realizing how bad this variant maybe is.
I tell anybody, it's their own right to choose, but I just strongly encourage it.
I'm Emily Carell, News 19, WLTX.
The United States could start giving COVID booster shots in just 2 weeks. Last month, President Biden touted boosters as a protection against COVID's more transmissible Delta variant and said Americans should consider getting one. Dr. Anthony Fauci says he believes by September 20th, pending approval by the FDA, those who receive the Pfizer could start getting boosters. Moderna recipients would follow a couple of weeks later while the company gives more data to the FDA on the booster's efficiency. Today, Biden's chief of staff said no one will get a booster until the FDA says they're approved.